Hi, everybody. Deborah Jackson here with Soul Health Conversations. We are starting this over the summer, and I'm so excited about all the people that I say heroes, that we have that are going to be part of this first season. And our very first conversation is going to be with Dr. Fayron Epps from Emory University in Atlanta, Georgia, of which is quite near and dear to my heart. And so just I wanted to share a little bit about Soul Health Conversations and what it's really all about. What I really felt led to do during this time. We have so many different things going on in our world, in our country right now, that I really felt led to engage people that have been in my life in a professional and personal capacity in dialogues that are enriching and soulful around various different platforms and programs and initiatives that they are involved in, as well as talking to them about how the purpose and pathway of their own lives, and to really truly present these people, these special people, into the lives of everyone out there so that they can be encouraged and inspired even during times where things are very uncertain. And so this is really an opportunity. We will start with our first 7 soul health conversations with me, which will begin airing next month and through the first part of the fall. And we are already working on a number of incredible conversations that we're going to be having in season 2. The conversations will all be free as part of the library that will be on my website at deborahmjackson.com. And you can register, once you register to be able to view the Soul Health conversations, you can view one, you can view all of them. And as I said, it is truly an opportunity for you to meet a whole new genre of people that are out in the world just completely making incredible impacts on people's lives. And so center yourself, reflect, connect to the deeper meaning of life's complexities that we're all facing right now. And you'll get an opportunity to talk to spiritual leaders and caregivers and clinical experts like Dr. Epps and people of faith and overcomers. And each one of the conversations, I really pray, will encourage and guide you in hope and great expectation and courage. And so with that, I would like to really start our conversation with Dr. Epps. So as I said, Dr. Epps is doing incredible things in her community and beyond, quite frankly. And so I just want to tell you a little bit about her, just the work that she's doing and her purpose and how it's just all spearheading life-changing and transformative research across the country. Dr. Epps is the principal investigator of the Faith Village Research Lab and an assistant professor at Emory University, near and dear to my heart, Nell Hodgson Woodruff School of Nursing. Dr. Epps has been a nurse for over 20 years and served in many clinical and leadership roles in the hospital setting. She received her BSN from Tuskegee University, MSN in Healthcare Systems Management from Loyola University in New Orleans, and a PhD in nursing from Southern University and A&M College. In 2015, she completed her postdoctoral fellowship with the National Hartford Center of Gerontological Nursing Excellence. Dr. Epps enjoys mentoring students and cultivating their love for the field of gerontology. Dr. Epps has devoted her career as a nurse leader to reducing health disparities for underserved populations through innovative, cultural, relevant programs for the African American community. She works closely with an interdisciplinary team to promote quality of life for African Americans living with dementia and their family, caregivers, care partners through self-care and meaningful activities. Dr. Epps is also the founder of Alter, the only nurse-led dementia-friendly initiative to support African American congregations. Dr. Epps oversees several faith-based research-related projects and is an active member in several local, regional national organizations. She's incredible. She currently serves on the board of directors for the Southern Gerontological Society, the Alzheimer's Association Georgia chapter, and Meals on Wheels Atlanta. What a mouthful. Thank you so much for joining us today, Dr. Epps.
Oh,
Can
thank you.
can you connect with our audience by telling us a little bit about how this journey became so rich for you?
So I think, and thank you for the introduction. Thank you
You're
for
welcome.
having me. I'm looking forward to this conversation.
Yeah.
And you know, it goes back to where did this get started, right?
Yes.
And
There's
so,
always a seed.
yes. And so I've been a nurse for over 20 years, a little bit over 20 years. And it was not until after I received my PhD that I knew what direction I wanted to go in. So I've always had older adults, the geriatric population, patients were have always been near and dear to my heart.
Mhm.
From the beginning, from high school when I became a CNA. But it was after my
Wow.
PhD is when I realized, okay, what I'm going to do with this. You
Mhm.
know, what do you do with a PhD? I was the first person with a PhD in my family, and so I didn't even know what a PhD was. And I still didn't know until close to graduation, like what the magnitude of what I was doing. I didn't grasp it until toward the end, and how the impact that I can have. And once I was able to see what other nurse researchers and nurse scientists were able to do, I decided, you know what, I want to make impact, and I want this impact to happen within my family, within the community I live in. And so that has been one of the driving forces to a lot of the work I've done.
Mhm.
And then for me to focus on uh, dementia and family caregiving, it was really, that was sparked when I started doing more reading. You
Okay.
know, they would say, Fayron, you can't help the world. You can't just focus on every chronic illness. As I might have did in the hospital when I was caring for patients, I had to narrow it down. And when I came and I started reading, Deborah, it was alarming to me when I saw the statistics of how dementia impacted certain communities of color.
Right.
And I just was clueless, because at that time I had no one in my family that had been diagnosed with any form of dementia. They had not been diagnosed with Alzheimer's disease. Now, I'm not saying it didn't exist. It just
Right.
wasn't talked about, and we didn't have a diagnosis. And I was actually, you know, I was raised as that's what white people get. That's one disease that we don't get.
Yeah, right. On the
And
contrary, right?
yeah. And so when I'm reading, I'm like, nah, this something's not right. Something's not matching up, because this
Right.
is not what has been poured into me from my community, my family. And now I have science and researchers telling me something different. And at that point, that's when I was like, this is it. If they, you know, if they're saying this, I need to go further investigate this. If it's true, I need to help. I need to see what it is that I can do to make this journey better. Because as I was reading everything and all the books, and I was just like, wow,
What do
wow.
you think? What do you think made you connect with it? So you look at the statistics. We feel, as Black women, having an affinity for our community. But what do you think that really lit a fuse in your heart about it?
It was me myself not knowing that this existed in such this alarming rate in my community. That's what, when I have my PhD, I've worked in the hospital, I've done all of this, and I didn't know that. That's what hit home, was like, you don't know this. Imagine how many other
Other
folks.
people.
Yes. And I brought it back to my mom, she's my
Yeah.
sounding board. I'm like, and she was like, what? Nah. Brought it to my aunt. Nah. Everything was like, nah. And I'm like, yes, this is what they're saying. And when I started doing my research, I geared my research toward that. And I started meeting other families. So I started meeting Black families. I'm from Louisiana. And so that's why I started this research and meeting these families. And I was just alarmed. And it was, Deborah, it was when one of my good friends that I was hanging out with, our kids play together.
Yeah.
It wasn't until I started doing this research and telling her about it that I knew her mom had a form of dementia. But we had been knowing each other for years.
So you didn't know her mom?
I did not know until I started.
And she never shared it?
Never shared it. And so that's kind of stood out to me. And it was like, wow, your close friends, you don't know. So either we ignore it or either, they are ashamed, they don't want to share it. And I appreciate her opening up. Once I shared my research, she was like, oh, my mama has this, that. And then after that, another associate said the same thing, and these are people we were going out with, hanging out, and we have these conversations, but none of this came up. And that's when I was like, this exists, and it's existing right here in my backyard.
And it was right there. This is somebody that was is such a dear person to you. And, when I hear that, many people may or may not know my story, that I am a full-time dementia caregiver and have been that way for 11 years now on the journey. But it almost sounds like with your situation, your friend wasn't necessarily hiding it, but when you shared the research you were doing, it sounds like she just really opened up would it be easy? Did she open up very easily for you?
Yes, Deborah. And when I realized that, and I was like, you know what? I'm about to talk about this everywhere I go. So every part, so being from New Orleans, every festival, every party, every block party that I was at, I was talking about dementia and Alzheimer's disease. If I'm out eating at happy hour, I was talking about it. And you'll be amazed how many of my friends or just people that I met that were being affected by this in some form or fashion. And
do you feel they were not normalizing it, but do you feel like what do you think? If
they
you
had no one to talk to.
That's what I was getting at.
Because no one understood it. And so finally, and once I started opening up about what I do, it was like, wait,
somebody cares. Somebody's spending time on this.
Or understands it, like they can have a conversation, because as many family members, and your role as a caregiver, when you try to speak to another family member, they're always, most of the time, nah, that's not the truth, because when I'm around, she or he is like this.
Yeah, they're fine. Or
that primary, that the caregiver, care partner is always around, does not, and if you really think about it, have an outlet. Have someone to talk to that really would say, I know what you're talking about. I get it. And yes, I know other families that have been through the same thing.
Right.
And it just started pouring from there, and them being open to being interviewed for my research. So that just opened up, and it showed me that in the Black community, I just needed to bring it up. And that everything else will fall in place, as it relates to research or any service and education that I need to do. I just first need to just bring it up.
As I'm listening to you, something came to, my heart as I was listening to you about purpose. And it came up because oftentimes I have young people even asking, I want to know why I'm here. I want to know what I'm supposed to do. I want to, and almost an anxiety over, I have a godson that is just anxious, especially during COVID, especially during the uncertainty that we're living in. What am I supposed to do? How am I going to get there? And I'm listening to you, and I'm following and tracking with you as you were describing your high school experience, which led to this experience, which led to another experience. And now you're sitting with a PhD and you're thinking, now what path do I take? And how right there was a conversation with a friend that stirred up more conversation that then led you really on an impassioned journey to keep digging and researching. Would you say that that's fair?
Yeah, what you said is actually what it is. And you know, like you're sharing, a lot of people say, well, how do you know what to do next? And I have to say, I really led, I'm a believer, I'm a Christian, and I
Right.
really let God order my steps. Now, I haven't always been like that, Deborah.
Well,
You know, I always wanted to do,
it's an evolving process.
yeah, I want to do my own thing. You know, I want to be retired by 35 and all
Oh,
this great
yes.
stuff. I had my own plans.
Mhm.
And, you know, then I had to really sit back. Well, of course, he might have made me sit back a couple of times, but I had to really sit back and see him do his work. And now I can truly say that I allow him to order my steps. This has became my ministry. So my research and my outreach, my service that I do is my ministry, and it brings me joy to be able to do this. And he leads, he puts the right folks in my path, that then will then lead me to another path and another path. And it's been all great and positive. And one of the biggest things is I listen.
Mhm.
You know, as families talk with me, if persons living with dementia call me up and tell me what's going on in their lives, I automatically start thinking, what can I do on my end? You know, I'm not in the lab to develop medicines. That's not my specialty. But what things I can develop to put in their lives to make it better as they're going through this journey. And I think they're able to see that as pastors come to me, I'm listening, you know, what they say. And I just, you know, I make sure I incorporate that into my research and also share with my colleagues. I just don't keep it, oh, I know this. No, I won't. It takes a village. It takes a village on
Literally.
the ground, yes, taking care of each other, but it also takes a village within the science world.
Yes.
How it takes us all to come together, share ideas to be able to really help families and improve outcomes for these families.
How do you think that this, so the thing I wanted to connect to with purpose that I think is so um, just fantastic about even just the story you share, you might not have even anticipated that I would kind of go in this direction. I like to be led by the Spirit as well. But I think it is such a testimony for young people that are at any juncture of their life that there is a trust factor that you can take one step and another step, and it's going to lead at some point, the threads will connect. And it's a matter of being able to walk that out and know that God's going, like you said, God will order your steps, but like you did not know necessarily from one step to the next that you would be here, right? And now you're here, right in the center of one of the most purposeful things that you never imagined that you would be doing, this research.
Exactly.
What would
No,
you say? What would you say to people that are struggling with that right now during this time, no matter what age they are? They could be in a place of intersection.
trust the process. Trust it. So as you were speaking, that's what came to me. It's just trust the process, you know, and I do a lot of reflection. So I've
Yeah.
always done that. I teach the students to do that, my kids to do that. You know, being able to reflect and seeing where you've came from, what you've accomplished, right?
Mhm.
What things you may want to change going forward. And during that reflection, thinking a little about moving forward, like what are those things you would like to accomplish?
Right.
And again, it's just trusting the process, because some things don't make sense.
Ooh,
It
that's
doesn't,
a mouthful right there.
it doesn't make sense. And when it doesn't make sense, that's the best. That's when you know it's going to have a great impactful outcome. And I always tell people, just trust the process, and do it from your heart. the things that you want to do and embark on, make sure it's not for the money. It's really
Say that 2 more times.
make sure it's not for the money. Yeah. So many people that want to come to nursing school, they be like, oh yeah, like, why you want to be a nurse? Oh, because they make a great salary. You're not going to be a great nurse, because there's no way, especially when you really want to be in your purpose, you cannot think about the dollar sign, because that you'll be using that as the driving force versus you really trying to have whatever impact or whatever needle you're trying to move. That should be more of the driving force. And
I was sharing
really
with them. Yeah, I'm sorry. Say that again.
No, I say I always share that with folks. So money is not the driving force for me. It's really me seeing more families saying, I got through this day. I got through this week.
I was saying to someone recently that there is a difference between vision and ambition. And vision comes from within, and it's given to us by the Lord. He gives us the vision. He is the initiator of the thing that he ends up showing us that kind of burns a hole in our heart, right? That comes from it's birthed from the Lord, but he births it in us. Whereas ambition is really all it's all driven by what we want. We're in pursuit of something because of what we've conjured up. It's very different. And so what I hear you really describing in your entire journey is trusting the process first, like you said. Now, you might not have trusted it, like you said in the beginning, but in hindsight, that's where we have our greatest lessons. And to look over your life and see these threads at this point, and then oh gosh, I trusted this step to this step to this step. And somehow, even if I made a misstep, it's still all working together. It's all coming together. How much would you say, so having the vision, trusting the process, how much would you say, because I heard you talk about this one time and I really loved it, this capacity to persevere, a capacity to persevere. I heard you say one time, never give up.
Yes. And I think, and having that resiliency, and I mean, if this is something you want to do, you don't give up. So, a lot of barriers and roadblocks will come in the way. But it's okay, because I don't even look at them as roadblocks or barriers. I just look at them as opportunities. So again, never giving up. And when I was in Louisiana, that was one of the themes for the church. My pastor, that was his theme, never give up. So it was embedded in me at all the services and stuff like that. And, I think that's very important that you don't give up, because it's not easy. And I hope I don't make it look like it's easy.
I mean, for me, you don't make it look easy, but you make it look possible. You don't make it look easy, but you speak to what is possible, right? Yes. I mean, just from purely the understanding of caregiving and dementia, these are not subjects that are at the forefront of our country all the time, right? And so we hear about a lot of things, but that's not necessarily something we're hearing about as often as we may want it to be heard. And so that means that you're talking to people, and you're talking to people within our community that in just that subject matter alone is really not at the forefront. And so the perseverance, the endurance, the willingness to push is not the right word, but to show up for people in an area that I don't know that people would say, generally speaking, oh, I feel seen, I feel heard as a caregiver, or, my grandmother died with Alzheimer's. And so I feel some kind of way about that because I grew up in the home with my parents who was caring for my grandmother who had Alzheimer's. These are not conversations at the forefront of our country. So I think that you don't make it look easy, but you make difficult things look possible.
Okay, I'll take that. I most definitely would take that. I had a person living with dementia. She shared with me, and she wrote this up on social media, is giving voice to the voiceless.
Mm-hmm.
And I really appreciate that. It made me sit back and, because sometimes I do, I go, 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 go.
Right.
And I'm like, wait, that post made me realize like, wow.
Yeah.
And it gave me, it made me want to go harder.
Yeah.
Right. Like, oh, you know what? I'm not sleeping, but you need to sleep. Let's correct that. We need
Yeah.
7
I
8 hours of sleep
understand.
each night. So
Yeah.
make sure we correct that. But it
Yeah.
just really made me go harder, hearing those words and hearing you say what you said about showing that it's possible. That really makes it me go harder, because I want others to be able to see that, so they can also be able to live out their vision and their purpose.
I'll tell you another reason why I show that your life is a reflection of what is possible, and the work you're doing is reflective of that, because having spent 20 years in corporate, I told you before I called on Emory University, but just knowing that healthcare environment, knowing business, the idea that you would get an opportunity to allow for your faith to sit at the center of the research that Emory University would support. Talk to us a little bit about that, because some people would automatically say, no way in the world is
Mhm.
something like that possible. Well, it is possible. We're not speaking to what God will do in other people's lives, but speak on that.
Yeah, so a lot of people say, what? Are you really? That's all you do? That's really? And you're at Emory?
Yeah,
And,
right. Mhm.
and before I came here, I was at Georgia State, and they was like, that's what you do? I'm like, yeah, this is what I do. And it's the way God, I have to say, he has given me, he has enlightened me on how to position it.
There you go. That is such a powerful thing.
Um,
That is powerful.
And so it is the center of everything I do. And I, just like when I came on and I told you all that I'm a believer, I'm a Christian, I tell that to everyone. So, I set the stage wherever I am, whatever conversation I'm at, every conference, so letting people know this is where I'm coming from.
Right, right.
You're on board or you're not. It's just that simple. But I follow up with stories. This is the impact that I've had. This is what families are telling me, and this is how they feel afterwards. And I think, the way I position it is, really focusing on how religiosity, the impact religiosity has
I started reading that article.
on these
Fantastic.
families.
Yes.
I think I think it's very important for us to see that. And as a nurse, a healthcare professional, my goal is not only to help out the families, but it's also to help clinicians and practitioners see the importance of religion and spirituality in their patients, and hopefully be able to incorporate that in their plan of care, or whatever discharge planning, or whatever they tell them to go home and do, not just overlook it. Like,
Right.
these are meaningful activities for these families, for these individuals, that can really make a difference, that can really bring somebody back into have a moment of lucidity, something that
Absolutely.
medicine cannot do, but
Absolutely.
maybe this activity can do. And getting them to see how important this is, and just don't skip over that question on their assessment or mumble it. Really understand it and know that, what, Dr. Epps has created some programs that we may be able to share with this family that could help them.
And I'd like to share with the audience too. I want you guys to know that as Dr. Epps has done more work, we're going to have to do more of this conversation and continue, because it's a disservice to not really share with people all the things that you've done, and also how it's changed you, how it's changing other people in their day-to-day life. And so we're talking about an evidence-based approach. So we're talking about you doing research that is supporting how these things are helping people, that the activities and the research that you're doing. And I would just say, I have seen, as a minister and a speaker and all that, but I have seen hospital systems over the last several years incorporate more into this, more spirituality and the conversation around faith, regardless of what a person's faith is, but faith into the healing journey and process. I have never until recently seen hospitals, you know, the TV commercials and things that they do where people share testimonies in the offices, where people are sharing testimonies about how their faith played a role in them overcoming cancer, how their faith played a role and they lost their loved one and then they ended up sick and they came. And so I'm seeing chaplaincy programs that are increasing over hospital systems. So clearly, universities, hospital systems like Emory, you're onto something. And there is a connection, right? I mean, you're seeing a connection. Talk to us about that a little bit.
When you say seeing a connection, tell me more, Deborah. I'm seeing a connection.
Meaning there is a connection between, for example, you did an article about religiosity and spirituality, right? And there is a connection that can be, for lack of a better word, I don't want to say tracked, but threaded between someone's well-being and their faith.
Yeah.
That's what I'm saying.
Yeah. So the connection, the things that we're seeing, it's different for the person living with dementia. It all depends on the stage that they're in.
Absolutely.
But, I had mentioned the moments of lucidity where they become present in that moment has impacted how they engage in these activities, how they may respond differently afterwards. And I haven't seen nothing that lasts over the week, but maybe right after, maybe be in a better spirit, or interaction is a little bit different. And remember, person with dementia, everyone is different.
Everyone is different.
One individual,
how the disease shows up on one person is very different than how it.
Yes.
That's one of the things that makes this disease so challenging,
especially for practitioners and for families. And then also for the family caregivers, it may not get rid of your stress, but I had a family caregiver tell me it helps with the stress management.
Say that one more time.
It helps with stress management.
Absolutely. That's very important.
So, I would never be stress-free. And I think that's the reality part we need to understand. We may never be stress-free, and that's for several different reasons. But these activities can help with managing your stress, which can help with the day and to go by a little bit better. And I will tell you, when I've seen families worship together, it has been so powerful. So I have, I know we'll continue our conversation, but, dementia-friendly services, worship services, in person and online. And I used to follow families to churches before COVID, and during COVID, I'll show them through Zoom, and just being able to sit there and watch these families that maybe never worshiped together, because never thought that their mom or brother still knew scriptures from the Bible, and for them to see that, they
remember.
It makes a difference for that family caregiver, because one family caregiver told me, I saw my husband again.
Even if it's sometimes a glimpse, that glimpse means so much in the moment of so many moments that just get stolen. And life is filled with moments. That's what we have when we go through so many different things in life. What we really move so quickly past are the things that resonate with us, that matter, and those are moments. And so just to what you're saying, I understand exactly what you're describing. Yes. So the feedback from so the feedback from many of the families that you've been working with is incredible.
Yeah. So no, Deborah, I wanted to piggyback on something you said a little bit earlier about how um, my work is impacting not just the families, but a lot more than that. And I have to say, I thought I was just here to help families. But recently this year, I realized it was beyond that. The work that I was doing was touching the students. So I thought, I'll bring students on board, I'll teach them about dementia and how to do this and that.
Mm-hmm.
But when I started seeing my students very interested in exploring different faith practices and trying to get a better understanding for themselves and where they are spiritually, where they're at on their spiritual journey, that was a very humbling experience for myself, because that wasn't my intention, right? But God, he had it set up, but that wasn't my intention. And I love my team so much, because they're like, let's start praying before our meetings.
Wow, look at that.
Right, and we're at Emory, like the students. And I said, are you sure? And yes, and they take turns and they rotate. And then we're all on this journey together where we're growing, as well as we're helping families maintain their spiritual connection. We are growing. And I feel so proud to say that it's a team. And, with my team, various backgrounds, faith backgrounds, some of them never had been exposed to religious practices or faith denomination. And, we welcome all and have that opportunity for them to learn and to do this. It's just been really amazing. And that has been the most rewarding experience, I have to say, within the last this has happened this year. So the last 7 months.
Yeah.
This has
been the pandemic.
Yeah, this has been really, really rewarding to me, knowing that the work that I'm doing is reaching not only just those families that are facing dementia, but also the students and those that I interact with on a professional level. Has just been like, yes.
Yeah, I mean, that is really special. That also speaks to how God is not one-dimensional. And so we're on one track and we are clear, and he's given us vision. And then somewhere out of left field, he comes and does something completely not expecting that he would do, that is really still all tied into the vision. It's just that his vision is even bigger than our vision.
Bigger, right?
That we can't handle it all. And, honestly, all of it speaks to why I feel so strongly about you as a person, why I feel so strongly about what you're putting out into the world for other people, why I feel so strongly about you and your dedication to our community and the work that you're doing. We are going to have to continue this conversation, because I want people to know about how you feel this has changed you. I want people to know more about questions they may have about the dementia side of things, specifically as caregivers in terms of research. And so we can continue the conversation, and even about how this has enriched the spiritual lives of the students that you just talked about in other ways. And so I look forward to us being able to continue the conversation. I'm so grateful for you being in my life and in my professional world as we get to know one another personally. Can you share with people your website and where people can find some of your work, learn more about what you're doing, learn more about you? And we will announce that the next time, maybe in season 2, when you're able to come back and talk to us some more.
Yes. So please, we're always trying to get our social media numbers up, but
yes.
My research lab is called Faith Village Research Lab, and you can find us on YouTube, Twitter, Facebook. So please look out for us. And we put a lot of information out about our research. And then not only just research, we also do education.
Yes.
and put things out that, especially for things that the African American community needs to know, is our way of promoting dementia awareness, and then also supporting brain health within the community. And the website is also Faith Village Research Lab. You can just type that in, it should come up. And then one thing we didn't talk about, and I know we'll say that in our future conversations, is my role with working with the churches and making them dementia.
Well, that again, I feel again, we just can't fit it all in. But yeah, that's so incredibly important, because I want people that will then come to you to be able to find where can they experience the dementia-friendly worship? Where can they experience these things and learn more about some of the things that you're seeding and working on now to help caregivers that I'm not going to say, I'll let you tell people about that when it's time. But I'm saying all of that to say there's so much that you're giving to the community that I can't wait for people to learn more about. And so again, I'm just thanking you so much. I love you. I'm wishing you just have an amazing rest of the year and all the work that you're doing. And obviously we will be talking again professionally, but again, you guys are just, hats off to Dr. Fayron Epps, Emory University, the work she's doing, the person she is, and let this be an encouragement and an inspiration for your weekend and your weeks ahead. And I can't wait to talk to you again.
Thank you.
You're welcome.